The islands on Kenya's northern coast are a beautiful spot for visitors. But for the local communities, the remote location means it can be a struggle to access vital healthcare services. These are the safari doctors. The team from Lamu Island braves the ocean in a bid to offer free medical care to isolated communities.
We access 10 to 12 villages at the moment, and in each village is about 100 people. So we travel with the medicine to address the basic ailments. There's a lot of respiratory issues. This inhaling the carbon monoxide from the cooking. There's a lot of dermatology issues.
Safari Doctors is the brainchild of 34-year-old Umra Omar, a resident of Lamu. She's not a medic herself, but she got together with Nurse Kalu in 2015 to start the project. Today, the Safari Doctors team has 11 regular members, as well as international and local volunteers. Dr. Abdul Hakim is one of the volunteer medics.
There are many reasons why there are not enough medical personnel here, especially nurses and doctors. Because one, I think this is a remote place. Second thing, because of security.
Some of the villages border Somalia and face the threat of attacks from the militant group Al-Shabaab. The first attack happened in 2011. Since then, local civilians have regularly been caught in the crossfire between the fundamentalist group and the Kenyan military.
I have treated one who was a victim of the bomb blast, and then we took her to Kijabe for treatment, but unfortunately that girl lost her leg.
The terrorist threat is very real for the doctors too.
One time, the Al-Shabaab came to Mangai, happened even to burn our motorbikes which we were using for safari doctors.
But even terrorist threats from over the border cannot deter this team. They know that without their help, people in marginalized communities simply won't get the medical care they need.
I had a bad cold which brought on blisters. You can see here. It's painful. I cannot turn like this. I wanted to go to Ram to the hospital, but transport here is difficult for us, and we don't have a health care center.
I have now been treated, and I'm grateful. I had ulcers, a headache, and a cold. I'm happy that the safari doctors came, but people from the neighboring villages, they're not so lucky.
In many parts of the country, people still rely on traditional medicine, but that's rarely sufficient to make up for the lack of proper treatment. The government has committed to improving security and universal health coverage, but it will take time for these worthy plans to become a reality in isolated communities. Until then, villagers will continue to rely on community projects to plug the gap.
We provide them with some of the supplies that they use when they go out on outreach. Essential commodities like vaccines. We also do allow some of our staff to join them during these outreaches. They help us reach some of those villages that we might have had a challenge reaching. So in a way that has been of help, at least delivering those primary services.
Services that we give are at no cost. And the concept is how we can make it sustainable through the Universal Healthcare Pledge, which Lamu County has fully subscribed to the NHIF plan.
As well as getting medical supplies from the government, Safari Doctors has established partnerships with various stakeholders in order to keep the project running. Umra Omar and her team offer a lifeline to these island communities, providing healthcare and hope in equal measure.